This lecture will cover homeostasis and feedback loops. Homeostasis is the maintaining of an internal consistency, maintaining an internal environment, maintaining a constant internal set points. You hear it described in a lot of different ways. We can give some very basic examples, like body temperature. Most people know that we really like to be at good old 98.6 degrees Fahrenheit. Our blood pressure, our doctor gets really happy if our blood pressure is around 80/20. Heart rate, normal heart rate is on average about 75 beats per minute. Okay, so we have these set points that our body really likes to be at. Now, it is perfectly normal to get outside of these ranges. Okay, so we get hot, our body temperature gets above 98.6 or gets below, maybe we get cold. Okay, our blood pressure gets too high sometimes. Our heart rate gets a little too high sometimes. Things like that. That's perfectly normal to get away from homeostasis. But our body is going to do its best to eventually get us back to homeostasis in one way or another. Okay, so we're going to go with the example of it being hot outside. Our body temperature is going to rise. So there are certain steps that are required to return our body to homeostasis. We're going to have a stimulus. Something's going to change. Okay, be it in our internal or our external environment. Something's going to be different. Somebody's going to notice that change. We're going to have a receptor, a sensory receptor. Sometimes we might know a specific type of sensory receptor, and if we do, that's great. Sometimes we're not really going to be super specific. We'll be a little bit more vague and just say sensory receptor. That's okay too. We're going to have a control center, a regulatory center. Someone must decide what to do about our problem. How are we going to fix the problem? Once we figure out how to fix the problem, what we're going to do, we're going to send that information through a messenger or a motor neuron. Somebody's going to have to tell somebody else how to fix our problem. Okay? Whoever is going to put the plan into action is going to be our effector. Okay? Once the plan is put into place and we start enacting the plan, eventually we will return to homeostasis. When we get back to homeostasis, okay, so if we're hot, once we get back to our 98.6 degrees, it's actually very important that we close our feedback loop. Okay. What we mean by closing our feedback loop, we mean that we need to stop enacting the plan. If we don't stop enacting the plan, we're going to have even more problems, and that's never good. So, our body temperature example, it's hot outside. Okay, that is our stimulus. Body temperature has increased above 98.6 degrees. Okay, somebody has noticed. In this case, we can call these thermoreceptors. Okay, so our thermoreceptors have noticed that it's gotten a little warm. We don't really like this. Who are we going to tell? We're going to tell our brain, our central nervous system. Okay, so our brain comes up with a plan. It's like, all right, we don't really want to be hot anymore. What are we going to do about it? Your brain is going to send signals to your body through the motor neurons, and we're going to activate our sweat glands. Okay. Now, our sweat glands, what are they going to do? They're going to sweat. Yeah, they're going to sweat. You're going to cool your body down through that sweat. No big deal, right? It gets us back to homeostasis. So, how are we going to work through these when we have examples? First, what's our stimulus? Sometimes it's very easy to recognize what the stimulus is. What's different than what you normally do? What are you doing that you don't normally do all day, every day? What's atypical? We mentioned for our sensory receptors, sometimes we might know a very specific name for a sensory receptor, like the thermoreceptors we just mentioned. Sometimes not. Sometimes we can just call them sensory receptors. That's all right. Your control center, your regulatory center. You've already learned that your two regulatory systems are your nervous system and your endocrine system. So these are your choices. It's either your nervous system or your endocrine system. Sometimes it could be your nervous system talking to your endocrine system. That's okay too. Okay? We're going to take that motor neuron. Okay? We're going to send that information out to the effector. Again, the effector is who is going to put the plan into action. Okay? When you talk about these examples, when you are asked for the effector, it's not just who did the work, it's what work is being done. So in our example, our body temperature example, we activated the sweat glands. The sweating is the work that is being done to cool down the body. A complete answer would include both of those. It's who is doing the work and what work is being done. Now, there are two different ways we can get back to homeostasis. We can do negative feedback or we can do positive feedback. Both of these processes help us get back to homeostasis. Okay? So one's not good versus bad. They just work in completely different ways to get us back to homeostasis. So negative feedback, you're going to oppose the stimulus, inhibit the stimulus, cancel the stimulus. Whatever is currently happening, okay, the stimulus, we would like to not do that anymore. We want to stop it. Okay? So in our body temperature example, we were hot. We didn't want to be hot anymore. So we sweated to cool our body down. So thermoregulation, blood pressure regulation, blood sugar regulation, all that's negative feedback. In fact, most processes in the body work through negative feedback. It's the most common type of feedback. Okay? Especially when we talk about examples in a basic anatomy and physiology course. But it's not the only way. Okay? So this just goes through our body temperature example again. Our stimulus was body temperature went above 98.6. Our sensory receptors recognized that. We talked to the brain came up with a plan. We used the motor neuron to activate our sweat glands. We sweated, we cooled down. Once we cool down, remember, we need to close that feedback loop. We need to stop sweating. Okay? Now, positive feedback. Again, this still helps us get back to homeostasis, just in a different way. Now we are going to enhance the stimulus. We're going to continue the stimulus. We're going to reinforce the stimulus. Whatever is currently happening, we're going to continue to do it until we get back to homeostasis. Okay? So, this is much less common than negative feedback. But we do have a couple of examples that people should be fairly familiar with. Childbirth, breastfeeding, and blood clotting. So for childbirth, how does the whole process start? Well, the baby moves down and the head starts to push on the cervix. Okay, that's our stimulus. That's a little abnormal. Okay. We're going to send nerve impulses from the cervix. We're going to tell the brain, like, all right, brain, it's time to deliver the baby. Okay. So the brain stimulates your pituitary gland, which is part of your endocrine system. We're going to secrete oxytocin, which is a hormone. Okay. And oxytocin goes through the blood, makes its way to the uterus. And oxytocin stimulates uterine contractions. Okay. And you'll notice that it's just a loop. We're going to continue to do that and do it over and over and over. Those uterine contractions are going to get stronger and stronger until we eventually push the baby out. Okay. And then the placenta as well. Now, once the uterus is empty, guess what? We're finally back to homeostasis. Took us forever, right? It seems like forever if you've ever gone through childbirth, okay? But sometimes the hard part of positive feedback is really figuring out what homeostasis was in the first place. What was our norm? Our norm was technically not being pregnant. Okay? Took us a while. Again, we had to reinforce that stimulus, those uterine contractions, that oxytocin release. We had to keep on going. But finally, we get back to homeostasis. Breastfeeding is similar in that once the baby starts suckling at the breast. We start milk production. As long as the baby continues to eat and drink the milk, we use the milk, we're going to make more milk. When the baby or the mom, whomever, decides that it is time to stop using the milk, the breasts realize that there's no point in continuing to make milk, and the breasts dry up. The milk dries up. Last but not least, blood clotting. You have a paper cut and you start to bleed a little bit. Homeostasis was, not bleeding from a paper cut. So how do we get back there? We need to clot. So we send platelets and other clotting factors to the wound. And we're going to have to keep sending them, and recruit more and more and more until we have enough platelets and enough clotting factors to where we fully clot and we're no longer bleeding. Now, once we're no longer bleeding from our little paper cut, we're back to homeostasis. And again, we talked about the importance of closing that feedback loop once we hit homeostasis, because what could happen if we continued to recruit more platelets and clotting factors? Okay, we could overdo it. We could end up with a clot too big. We could block a blood vessel. That clot could break off. We could end up with an embolism, something like that, and that's not our goal. Okay, so remember the importance of closing that feedback loop. Our labor and delivery example. One more time, that baby's head pushes on the cervix. That is our stimulus. Let's get that baby out. I'm going to send that info to the brain. The brain is actually also going to talk with your endocrine system. Okay, we're going to send that message to the endocrine system, the pituitary gland. And that pituitary gland is actually going to be the one to release the oxytocin, which causes the uterine contractions, and we continue the loop until the uterus is empty. So, last but not least, we know that it's perfectly okay to get away from homeostasis. We have ways to get back to homeostasis. But what happens if we can't? That's when we get disease and illness, medical conditions that we need to treat with outside help. Medications, medical devices, things like that. So we haven't mentioned blood sugar yet, but most people are familiar with diabetes. If you suffer from type 2 diabetes, what's wrong? You can no longer regulate your own blood sugar levels like you were supposed to. So you would end up needing some medical intervention to help you get back to homeostasis on a regular basis. You might need to take insulin or other medications. You might be asked to modify your diet, things like that. Okay, so when your body can no longer get back to homeostasis by itself, then we need outside help. Again, we need medical intervention because it's still important that we get back to homeostasis. And that concludes this lecture on homeostasis and feedback loops.